Good morning everyone. I am Dr. Samanthi Konarasinghe from Institute of Mathematics and Management, Sri Lanka. Today I am going to talk about the importance of mathematical modeling in forecasting disease. What are infectious diseases? Infectious diseases are diseases caused by living organisms like viruses, bacteria and fungi. So, COVID-19, it is an infectious disease. Diseases spread from animals are not called infectious diseases, they are called zoonotic diseases. If an infectious disease spread within a country or within a certain area, that is known as epidemic. And if it is spread across the seas or across the boundaries of a country, then it is known as pandemic. That's how COVID-19 has become a pandemic. Why mathematical modeling is important in defeating epidemics or pandemics? First reason is these mathematical models help understanding the patterns. So early detection help controlling the spread, and forecasting help important activities like governments and healthcare services can anticipate the requirements of healthcare resources, and it will help saving the human lives. Also, government authorities can decide the lockdown procedures, and the governments can make use them for economic policy developments. When we talk about the disease modeling, it doesn't come to our mind. We think it is a problem with healthcare services, but no. We all have experienced that how these infectious diseases affect to the economy of country. Sri Lanka is a very good example. I'm so sorry to say, but see, our economic crisis mainly due to the COVID-19 outbreak. So if Sri Lanka made use the scientific forecasting or mathematical modeling in advance, this would not have been happened. Countries who recovered like Singapore, they have made use the mathematical modeling and scientific forecasting to recover. That is the success of their early recovery. Unfortunately, some countries did not make use it. I'm telling you, in future, we must get the maximum use of scientific forecasting. Scientific forecasting is based on mathematical modeling. What is a mathematical model? It is a simplification of a real-world situation into an equation or set of equations. That means we are converting a real-world problem into mathematical language. Then solve it and make use it to forecast or estimate the real-world situation. Mathematical models are classified in many ways. Stochastic models, deterministic models, static models, dynamic models, likewise. So, statistical models are the stochastic models. That means statistical models also part of this big family of mathematical models. Let's look at the history of mathematical modeling for infectious disease. It started in 1662 as recorded. John Grant, he is the first one who used mathematical modeling. After that, Daniel Bernoulli and other mathematicians have used them. Among them, in 1927, McKendrick and Kermack, their finding is very important. They developed Kermack-McKendrick epidemic model. It is the base of the susceptible infectious recovered model or the SIR model. Though it was developed in 1927, still it is very prominent in the field. At present, what are the commonly used models in forecasting disease? If we think about the present situation, COVID-19, SIR model was highly applied, and the improved versions of the SIR model like SEIR, SEIRD, SEIRS, and so many other versions are there. In addition to that, time series forecasting played a vital role. Actually speaking, time series models were superior to the SIR and other versions of them. Among the time series techniques, exponential smoothing, ARIMA-SARIMA, summer circular model, they were highly successful. So let's take one by one. SIR model or susceptible infected recovery or removed model. This was the first. Susceptibles, infect and recoveries. This model is known as a compartment model. That means, look at this diagram. Susceptibles, infecteds, recoveries, 3 compartments. So there are movements in between. This method is a system. This SIR, it doesn't contain the birth and death. That means the population size is considered as a constant. So you can see it is a system of differential equations. It has 4 first order differential equations. Solving this one using some software, you can get forecast or estimate the susceptible cases, infected cases, recoveries, and so on. So for this one need to have a sound knowledge in mathematics. That means advanced mathematical techniques as well as programming knowledge. However, SIR system and improved versions were highly useful in disease modeling. As I said, time series forecastings were highly applicable at this time, the COVID-19, even before that. So, Institute of Mathematics and Management, I am proud to say that we also contributed a lot. This contribution, truly it is not from me. I am not the person who contributed for this one. This Konara Singha is not myself. This is Major KMUB Konara Singha, the Managing Director of the Institute of Mathematics and Management. He spent almost all his time, starting from 2020, with the beginning of the COVID-19. He started working on this, and he had done a lot, and even WHO has identified the prominence of his contribution to the field. So he had used various techniques for modeling COVID-19, starting from the highest spreaded countries, USA, UK and Russia. At that time, 2020, they were the most spreaded countries. And then for India, Brazil and Australia. Then still he is working on it. First wave, second wave, third wave, he identified all these patterns and spent his time on helping the society to make precautions. You can read these articles. They are available. You can get these things from the internet and get more details about them, especially those who are interested in scientific forecasting on epidemics and pandemics. These articles will be very helpful. As I said, WHO also given a prominent place for his findings. So in 2021, when Major Uday Konarasinghe was analyzing the data, he found wave-like patterns. See the last two. This one. Modeling wave-like patterns of daily infected cases. So he found that like after second or third wave, this number of infected cases follow wave-like pattern, irregular wave-like pattern. To capture the irregular wave-like patterns, there were two methods he found successful. One is seasonal arima or Sarima model. Second one is Sama circular model. Among them, he found that the Sama circular model is superior. However, both Sarima and Sama circular model were really doing a good job. Still, he found that these wave-like patterns are with the increasing amplitude sometimes and decreasing amplitudes in another time. Look at these diagrams. These are the daily infected cases of India. Here see the first wave, second wave. See, number of infected cases are increasing. Amplitude means the height of the wave. Cases are increasing, decreasing, again increasing, decreasing. This pattern, he said, though the Sama circular model and Sarima are suitable for forecasting, they are unable to capture this increasing and decreasing behavior. And he asked me whether it is possible to develop a method to capture them. Then, as a mathematician, I started thinking about it. This Sama circular model is the improved version of the circular model of my PhD finding in 2016. I developed it for share market forecasting. Later, I improved it to overcome one of the weaknesses. So they were initially applied in share market forecasting and consumer price index and other economic variables, tourism industry also. In 2020 to 21, Major Uday applied it for disease modeling, as I said earlier, and it was successful. Upon his request, I started thinking about improving, and actually I improved the circular model. The development outcome, two new forecasting technique, damped circular model and forced circular model. They are actually joint developments of myself and Major Uday. So they are suitable for forecasting wave-like patterns with increasing amplitudes or decreasing amplitudes. So I am happy that as academicians and researchers or as an institution, we have done something to the world. Even if my country is facing numerous problems at this time, we have not stopped our contribution to the world. Whatever happened, we are obliged to serve the society. So we keep doing our research work. I request you, scientists, also do your part, irrespective of the others, without blaming the politicians. Without blaming the others, let's do our part and try to contribute something to make a better world. So practice makes perfect. If you want to do something, learn techniques properly and practice them. And Institute of Mathematics and Management motto, determined, dedicated and done. So we determined, we dedicated and we have done and not stopped. We know we did only a little. We have to do a lot. So let's do things together, share our knowledge. I take this opportunity to thank you all for being with me. Have a good day.